This is Becky. I know a lot of you have seen my messages online about my lungs and my asthma, my breathing, and I've asked for prayers a lot in the last couple of weeks. And I don't want to be on video today because honestly, my hair and everything doesn't look the best. You don't want to see what I look like right now, but I wanted you to hear me because it's kind of a direct result of what's going on right now. And just so you know, this is what maintaining my 51% lung capacity, my asthma looks like right now. So, I mean, some of you might be familiar with a lot of this, but basically, these are all my daily maintenance meds. I've got lots of stuff I'm dealing with right now, and this is just the daily maintenance stuff over on the left here. This is the medicine for my machine. I can do that as I need every 4 to 6 hours. This is a long-acting inhaler called Advair. It's a daily. I'm on the highest dose possible for that, and I have been for about 2 years now. Allergies, because if I can't control my allergies, which are most of my triggers, then my lungs get really bad. This is a Singular, which is a daily maintenance drug, which controls both allergy and inflammation, asthma, and I've been on that for probably close to 10 years now. I can stop taking that, and within 2 to 3 days, I can notice a difference with my throat and my inflammation and my breathing. And then they've started in the last probably about 3 or 4 years. I've started a nasal steroid, and now they've just recently started me on a nasal allergy. So, and then this is my rescue inhaler. You guys are probably most familiar with that. What's been happening the last couple weeks with this spring has hit me really, really hard. I've had the flu about 6, 7 weeks ago, and I went through a round of oral steroids, which is in addition to all of these things, an oral steroids of pills. I have a pulmonologist that actually, because I've been dealing with this so much and so long, that she actually allows me to keep a supply of oral steroids in the house at all times because she wants me to be able to take them when I need to take them. And she knows that I've been dealing with this long enough to understand the right time of when to take it and how to take it. But I took those about 4 or 5 weeks ago after the flu. It took about 2 full weeks to really go into effect. And I was probably really breathing really good for maybe about 5 to 7 days. And then I started to get a little bit of the asthma back, but I had no other symptoms. I never had a cold. I never had nothing. Just the asthma kind of relapsed. So I went to see her because I'm actually getting ready to do another long-term regimen. And I can't start the new procedure that I'm going to do while I'm feeling this way. So she started me on another round of oral prednisone, and then this is a new oral steroid. So these are 2 new things that I've added this week, in addition to all of these other things. What you're hearing in my voice right now is what I was asking you guys to pray for the past couple of days. It has nothing to do with any virus or cold that I've gotten. But what has happened and what I've just discovered yesterday is that this new oral steroid, voice hoarseness and voice deepening, apparently is a side effect of this inhaler, which I was not aware of until yesterday, and it started happening. And of course, you don't read the packet all the time until after something happens, and there it was. So, excuse me, I'm sorry. But that's what I've been dealing with, and that's what I've been asking prayers for. And I thought it'd be a good idea for you guys to kind of get a day in the life. I never talk about this. My kids are always the focus of my world. But this is just something that I go through personally in addition to everything else in our family. And I'm not sharing this because I want sympathy or pity. I'm just sharing this as an awareness. All of these drugs do so many different things and have so many different side effects to the body. In addition to what I'm dealing with my throat and my voice now, is that Something I've been dealing with actually for 2 years that Dan and I haven't discussed with anybody is I've had a raised white count in my blood. And they've actually been keeping an eye on it for 2 or 3 years. And for the first year, it was kind of just keeping an eye on it, seeing where the average numbers were, testing for infections. Nothing ever came up. And then last year, about 12, 15 months ago, I was sent to a hematologist because it was just at that point where it had been going on too long, and there was a concern of possibly, it was a small possibility, but there was a slight possibility. They just wanted to rule out any type of leukemia because of my numbers in my blood. And I went to the hematologist, and thankfully he was very, 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 what's the word? Aware of kind of what could happen when I'm on these, when anybody is on these types of drugs, and what has happened and what he's explained to me. And he's also just keeping an eye on me just to make sure the past 12 to 15 months is I have something called in my blood called acute leukocytosis. And basically, because of any long-term steroid use, my white count in my blood is constantly elevated. What happens when that happens is it's harder for physicians to decipher if I have an infection in my body or if it's just the acute leukocytosis. So if I do ever get infections, white count, they're going to have to look for it in other ways because the white count is not going to give them a definitive indicator of infections because it's a side effect of these meds. Also, what happens is I get really tired all of the time because your body thinks it's fighting something, but you're not. It's just, it doesn't have any long-term effects. It doesn't increase my risk of anything else. It's just more of a nuisance where my body just thinks it's always fighting something. So I get tired faster, not only from not being able to always get the oxygen that I can get, but I also get tired faster because my white count is elevated and my body thinks it's fighting things that it's not really fighting. Apparently, it's just from long-term steroid use. So when I got that news last year, I actually decided that I just wanted to do everything I could to minimize the steroid use. But that was also a difficult decision because at the same time, I also got confirmation that I definitely only have a 51% lung capacity. So imagine if you're just breathing with one and a little bit more than one of your lungs. That's basically how I've been dealing for several years. And I'll get into the long-term story later. But I received confirmation that the right side of my diaphragm is paralyzed. It's called unilateral diaphragm paralysis. So basically, my lung can function, but it doesn't function because the diaphragm does not move and it does not expand my lung to bring in the air that it should. The reason I have 51% is because my ribs muscles basically have compensated for some of that, slightly, obviously, but not enough to make a difference to where I feel like I'm functioning normally. So my long-term goal right now is obviously to minimize most of these drugs. There is a surgery that can be done for my diaphragm, but I've been told there's only a 10% chance that it will increase or make any type of improvement. So that's really not an option right now. So what we're doing is I'm going to be going on a new drug that is going to isolate the allergy reactions in my body. And I'm supposed to be starting that in about any day now, really. It's a shot that I will get once a month. And it carries its own risks, so I will have to carry an EpiPen with me. But that's what I'm kind of excited about, the new drug, because it does have promise. I've been told that they could increase my lung functioning up to as much as 70 to 75%. And for somebody who's been living with 51% for so many years, the thought of that would just be amazing. So anyway, if you could continue your prayers for me, that I could get through this phase of the asthma flare up so that I can start that new drug. And if you could pray with me through that therapy, because I have to be on that additional drug for 6 months before they can start removing any of these drugs. So it's going to be a long process, but it is a very promising process. So if you could pray for that, I'd appreciate it. And also, if you could pray for my voice to come back, I would really appreciate that too, because it's really it's really not cool to yell at your kids and have your voice crack and everybody laughs. But then again, I guess that's just a reminder I probably shouldn't be yelling, right? All right. I'll talk to you later, guys. Thank you. Bye.